Good morning. As we mark the one-year anniversary of the COVID-19 pandemic, what lies ahead in this scientific battle against a very deadly virus? Can we get enough vaccination shots in enough arms, even the youngest among us, before it's too late? We'll ask Veronica McNally, the only Michigan member of the Center for Disease Control Advisory Committee on Immunization Practices. Her campaign for vaccinations is drawing national attention. And later on our Sunday morning program, we'll look at the unique role social workers are playing in addressing post-COVID health and behavioral concerns. To say it's been a stressful year would indeed be an understatement. Joining us to share their advice will be Wayne State University educators, Dr. Shantalia Johns and Dr. Megan Hicks. It's Sunday, March the 14th. I'm Chuck Stokes, and this is Spotlight. Veronica McNally, thank you so much for joining us today on Spotlight and kicking off our program here this morning. Help me out big picture-wise. Give me a quick overview of where the U.S. stands and where Michigan stands in terms of vaccination rates.
We're doing well. We have a long way to go. So overall, the U.S. population has received almost 100 million doses of the coronavirus vaccine. And Michigan is doing really well right now. In fact, one of the locations in Detroit has one of the highest vaccination rates in the country in terms of daily vaccination rates. Michigan has given almost 1 million vaccine doses. So we are doing everything that we can to get this shot into the arms of people.
In terms of vaccination rates in general, our state's not doing well, right? In making sure that our kids and others are vaccinated?
That's absolutely right. So because of the coronavirus and the stay-at-home order that was in place earlier this year in Michigan and in other states, our vaccination rates for vaccination against other vaccine preventable diseases decreased fairly significantly. So for pediatric rates, it decreased about 15% from where we were last year. And that is significant. That is something that we want to pay close attention to. We want parents to go out there and get their kids caught up on their necessary vaccines.
And very quickly, I saw a figure, tell me if it's right, that among the 50 U.S. states, we're way down there, like 43rd?
So where we are exactly at this moment in time, I can't tell you, but I can tell you that we were doing great prior to the pandemic. We had increased in our rankings. I believe we were 29th in the nation. And so any slip from there is problematic for our children and our adolescents.
All right. You are the only Michigan member on the CDC committee that gives approval to these vaccines. We now have 3 vaccines. What's potentially coming down the pipe?
I think that we are going to see some pediatric candidates in the near future. Dr. Fauci has said that he hopes that school-age children 6 and above will be able to get the coronavirus vaccine this fall. It's not that the risk is common. It's a rare risk for children to have a poor outcome from coronavirus, but it's there. And parents need to understand that there is a risk for their children. And I think that we all want our kids back to school. I have 3 children. I can't wait for my kids to resume a normal daily schedule in school. And getting vaccinated, if it's shown to be safe and effective, is going to be really a wonderful thing.
Sure. Ms. McNally, you're an attorney by profession. You're an assistant dean at the Michigan State University Law School. Why is vaccinations, why is that such a passion for you?
Well, I lost an infant daughter to a vaccine preventable disease in 2012. Her name was Francesca Marie. She was absolutely the joy of our life. My children were so excited to have a sister, and when she became infected with whooping cough, which is a bacterial infection, we just couldn't have possibly imagined what would come next. And I felt really strongly after she passed away about making sure that parents got the information they needed to understand how they could protect their children from vaccine preventable diseases. And that's how I became a public health advocate.
You started a foundation in her memory. Tell us a little bit about that foundation and what you hope to accomplish with it.
Thank you. The foundation is called the Franny Strong Foundation, and its mission is to educate parents and medical care professionals about the benefit of vaccines and vaccine preventable diseases. When we started out trying to educate really specifically about whooping cough or pertussis, which is what Francesca died from. But it became very clear to us early in that process that we needed to be talking about all vaccine preventable diseases. And so it was just shortly after she passed away that I created the I Vaccinate campaign. And that is a campaign designed to get parents credible information and research about vaccines and vaccine preventable diseases. And we've just had great success with it. We launched it in March of 2017. And the website we drive parents to for that information is ivaccinate.org. We were really lucky in 2017 to be able to partner with the Michigan Department of Health and Human Services on this campaign.
We are certainly sorry for your personal loss, but we are certainly glad that you have started this foundation to make others aware of what needs to be done in this state and in this country. We are going to take a quick break. We'll hurry right back with some more questions right after this. And welcome back to Spotlight. Ms. McNally, this next vaccine that will come out, can you tell us a little bit more about it?
Right now, for infants and children, there are 4 vaccine manufacturers who have indicated that they plan, as of January, that they had planned for adolescent and pediatric trials. So it's some of the same manufacturers that we have right now with the coronavirus vaccine for adults. So Pfizer has a vaccine clinical trial planned for children, as well as Moderna. Janssen is currently looking at the pediatric vaccine, and there's also one for AstraZeneca. There may be others. That was what I knew of as of January.
Can you tell the people that once they get that approval, that these vaccinations will be safe and effective for such young people, because their systems are different than adults?
Absolutely. So this vaccine for children will go through the same regulatory process that all vaccines go through for approval. And the way that it moves through in a regulatory system is that it goes to the FDA for approval based on safety and efficacy. It then comes to the ACIP, which is a committee that advises the CDC. And then after the CDC would recommend that this vaccine be available for use in the US population, there's what's called post monitoring that happens to make sure that the vaccine's benefits outweigh any risks, so to ensure that it is safe and effective.
Veronica McNally, you know just from doing this work that there's still a significant number of people who, for one reason or another, it might be religious, it might be for health reasons, it just may be their own philosophy, that they are anti-vaccines, especially when it comes to their children. And because their kids are minors, as adults, they get to make those decisions. Address that constituency out there.
Talking about confidence in vaccines and vaccine hesitancy is something we have to be doing more. And for people who have concerns about vaccines, I really encourage them to get answers to their questions. Don't assume that you know the information. Do you have a question about the product itself? Do you have a question regarding your provider? Do you have a question about the policymakers for these vaccines? And get answers to those questions. That is exactly why I created ivaccinate.org. What I have found is that people up until this particular disease didn't quite understand the concept of herd immunity, and a vaccine is the way out of this pandemic.
If it's one thing that I've heard a lot of young women try to question and get answers to, it is whether or not the COVID-19 vaccine is safe for them to take if they're thinking about becoming pregnant and starting a family. What can you say to these people that have to make a very serious decision along these lines?
To talk to their provider, to make sure that they have a conversation with someone who has good information. I will tell you that the ACIP wanted to make sure that that option was available to women who were going to become pregnant, to pregnant women, and to breastfeeding women. So you have to think about whether you have risk for getting coronavirus, and if you do, then you'll have to make that decision. But right now, this vaccine has a very favorable safety and efficacy profile, and so please have confidence that people are examining this issue.
Quick final question. With all these hats that you wear, I don't know how you have time to do your day job there at Michigan State University. Talk to us briefly about what you do there and what do you see as your future in terms of the legal field?
Oh, I work with students on their hands-on learning. So to go out there and practice the lawyering that they will eventually have a chance to do. So if it's students who are working in externships at a location where they're performing lawyering tasks and receiving credit for that, I work with our mock trial teams. I work with our clinic students. So really making sure that they're ready to hit the ground running when they graduate. I have done this job for a long time. I really enjoy this job. And I think it's part of the reason why I feel so passionately about advocacy and public health advocacy.
Quick yes or no, with all that you've seen and the different meetings that you've been in and the information that you're privy to, are you optimistic or pessimistic about where the United States is headed in terms of this battle against COVID-19?
I am absolutely optimistic, and I think that everyone else can be as well.
All right. Veronica McNally, thank you so much for joining us today on Spotlight. We have to get you back, update us. How much longer will you be on this committee?
My term ends in June of 2022. I will look forward to talking with you again, I hope.
All right, we've got plenty of time, then we'll get you back. Thank you so much and stay safe.
Take care.
Thank you. And coming up, we'll turn our attention to COVID-19 in a slightly different type of way, kind of post-COVID-19, and what social workers and educators are doing to make sure that people have the information that they need to address what has been, for many, a very stressful and traumatic year. We'll be right back. Stay with us. And welcome back to Spotlight. Joining me now to continue this discussion about COVID-19 is Dr. Shantalia Johns from Wayne State University and Dr. Megan Hicks, also of Wayne State University. Thank you so much for joining me on Spotlight today. Dr. Johns, I'm going to begin with you. You're a proud Detroit Public Schools graduate and then went on to Wayne State University to earn your doctorate in education. If there's one thing we've seen this year, we have seen people deal with stress, anxieties, isolation, whether it's economic stress or it's behavioral stress or whatever else, and that oftentimes trickles down to our children. What kind of advice and guidance can you give parents and other adults out there that are working with our children to help them deal with what they have gone through this past year, which they may or may not have articulated or verbalized to adults?
So as we think about all that has happened and supporting our children, I do have just a few tips that we can, that I can provide educators and parents on how to support their child. First, think about offering a safe and predictable environment for the child. Mm-hmm. So for educators, that may mean, in terms of safety, creating a classroom where there's very little trauma triggers. So if you are going to talk about something sensitive, an example would be to give the child a warning or create a safe space where the child can go to so that they can process what is being talked about or just step away because it's too much for them. I also think that educators can put together daily schedules. Again, thinking about creating a predictable environment. So creating daily schedules, even talking with the children about the safety procedures within the school so that they can know what the school has been doing to make sure that they're safe.
But the key is making sure you have conversations with them and not assume that everything's A-okay.
Absolutely. Because again, some children may not know how to verbalize how they're feeling, or they may not feel comfortable talking with everyone in the class about what's happening.
As we sit in National Social Worker Month, I'm going to turn to you, Dr. Hicks. You do a lot with health disparities, especially among people of color, minorities. What impact has this pandemic had on that population?
Yeah, so there's been, a truly multi-level impact. There's been, disparities in learning and disparities in testing and getting vaccinated. But luckily, in Detroit's doing a great job, and this disparity is low. So there's a high percentage of Black people in Detroit getting vaccinated. So that's a big positive that we're seeing.
What is it that colleges and universities can be doing at their level, given all of the academic training that they have, to be able to help address this problem for the larger society?
Yeah, so COVID really, exposed the disparity in learning and access to internet, access to the appropriate technology. And so going forward, I think we need to really remember that. And COVID exposed the different contexts at home that may impede learning. And so I think we need to remember that going forward. And Wayne State had a great program where they provided Chromebooks and opened up parking lots to provide internet access. And I think, not necessarily cutting those programs off, but keeping those resources alive for students in need is going to be important.
Excellent. We need to take a little break. When we come back, I want both of you to talk a little bit about the role that social workers play and the impact that they're having on our society, and particularly as it relates to COVID-19. We'll be right back. Stay with us. Doctors, and I'll start with you, Dr. Johns, and then Dr. Hicks, would like for you to address it as well. Talk a little bit about the importance of social workers and what role they have played during the pandemic as we're, I won't say coming totally out of it, but at least seeing, I think, some light at the end of the tunnel with so many vaccinations now starting to get into the arms of our citizens.
So social workers are trained to help families address barriers to living a fulfilling life. And that's exactly what social workers have been doing. We've been stepping up, connecting families to resources, being a part of interprofessional groups within schools and hospital settings, helping families get the resources that they need during this time. And then as we think about post-COVID, our social workers will be right there, continuing to offer support, connecting children and families to psychological support. If I can just give a happy Social Work Month to all of my colleagues who are out there as first responders trying to make a difference.
Sure. Dr. Hicks, I'd like for you to talk a little bit about the role of social workers, and there are probably a lot of people out there who are thinking to themselves, yeah, I'd like to talk to somebody. I need some help, whether it's major or it's minor in terms of what they're dealing with. But one, they may be afraid to reach out. And two, the biggest fear may be they may say, I can't afford something like that. Are there some services out there that might be free and it wouldn't tax their pocketbooks?
Yeah, so a big resource that I've been telling people about has been social media and an informal resource. So a lot of people have created, people as in social workers as well, therapists, they've really taken to their Instagrams, Facebooks to offer, tips and ways to process through COVID and process through trauma. And so that's a free resource, that people could follow in the community. Another resource that is a real big positive that came out of COVID is telehealth. And this really opened up access to care to a lot of people. And especially in the Black community, there's a big stigma around receiving care. And I truly believe that telehealth, receiving care over the phone or in your home, you don't have to, go visit an office and have everyone looking at you. And so I think telehealth is a great resource, and it's often the same copay as going to a doctor if you have that resource. And so telehealth is a big resource that came out of COVID. That's a positive that I want people to know about.
Dr. Johns, are you seeing more and more young people choosing to go into social work or somewhat related fields?
As we think about and have been processing not only the pandemic, but all the other social injustices that have been happening, I have definitely seen younger people standing up, looking to create a more socially just society. But we need more. We need more people willing to help those who are vulnerable, speak up when they see inequalities, and really just take the charge in trying to make our world a better place.
What's the best thing you can say about it if a young person is out there watching and thinking about maybe choosing to go into this field or something related to it?
Especially for Black students, it's very important to have representation in this field and be able to show up for our own communities. And so I think that's very powerful, as well as, really connecting with people. And so if you have a passion to be with people and help people in the community, this is a really good position for you to be in.
All right, very good. Dr. Johns and Dr. Hicks, thank you so much for joining us today on Spotlight. I know that you've been super busy this last year in particular, but we're glad that you and other social workers are there on the front line and keep doing what you're doing. And we want to thank you at home for joining us. I'm Chuck Stokes. We'll be back next week with more newsmakers in the Spotlight. We hope you have a great week.